Hello, Year 2 MPharm. Welcome to the first section of my lecture on fungal infections. I'm recording this on a very rainy August day. I suspect you'll be watching this more likely in December. So I hope you're having a good semester so far and things are going well for you. I've got the usual kind of format for my lecture today. So I'll be doing 3 sections, each with an activity associated with it to help you bring together what you've learned and do a bit of extra reading around the subject. So there's going to be some horrible pictures of fungal infections in this lecture. So if you've not had breakfast yet, you might want to take a few minutes to get ready for that. It's things that you're going to see in the pharmacy. My colleagues who are pharmacists will tell me that people will gladly show you all this kind of infection in the consulting room in a pharmacy. So you need to get used to seeing these kind of infections up close because you will be doing professionally in the future. So fungal infections are a really common reason for people to come into a community pharmacy, and you'll be often asked lots of questions about them. You'll be asked how to treat them. You'll be asked to give advice, etc. So I thought it was a good idea for you to have some of the microbiology knowledge behind the advice that you give to your patients to help them resolve their fungal infections. So what we're going to do is we're going to look at the most common ones that you're going to see in practice, and you will, I guarantee you. We're going to look at some of our patients who are more vulnerable to fungal infections. So these are people who are immunocompromised, so people whose immune system doesn't work as it should. So anyone who's taking long-term immunosuppressant drugs, for example, people who are receiving chemotherapy for cancers, people who have chronic illnesses, so perhaps diabetic patients, people who've had transplants, etc. So that group of patients needs special attention regarding fungal infection. And then finally, we're going to look at what's important in terms of antimicrobials in pharmacy. So as with any antimicrobials, we are seeing resistance amongst fungal isolates seen in pharmacy. So we need to keep an eye on that, and we'll look at what you can do to try and prevent resistance to antifungal agents. So essentially, fungal infections are superficial on the whole. We'll look at when things go a bit wrong later. And these are caused by fungi called the dermatophytes. And these fungi essentially cause skin, hair and nail infections. They're the ones that you're going to see lots of in pharmacy. And the fungi that cause these infections are trichophyton, microsporum and epidermophyton. And that's basically named because of where they live on the skin and the hair, etc. So fungi are actually really beautiful down the microscope. We won't get a chance to do this, you're not microbiologists, but fungi stain beautifully, and you can see all their spores and their hyphae and the way that they grow through tissue, etc. The way that fungi produce hyphae and can branch and spread gives them a real advantage when they're trying to invade skin and hair, etc. So these are the culprits that we're trying to kill when our patients end up with these superficial infections. Remember that fungi are eukaryotic, the same as us, so that makes treatment a bit more difficult. So we don't have as many what we call, remember, selective targets in fungi. There are a few things that are different between us. So fungi have different cell walls to us, so we can use that as a target. They have some different protein synthesis machinery as well compared to us. But we don't have as many options as we do when treating bacteria. And often, some of these antifungal agents can have some side effects because they will also affect the eukaryotic cell, which further complicates matters. And in addition to that, we often have to ask our patients to take these drugs for quite a long time in order to kill the fungi, because they are quite resilient and they take a long time to die. So those side effects might become more pronounced over time. So careful counselling of our patients is required when they're taking antifungal therapy to make sure they complete the courses and make sure they eliminate their infection effectively. So this is confusing, which is why I've put it on so you know the difference. There's a very common skin infection called ringworm, and it has nothing to do with worms, okay, and everything to do with fungus. It's caused by a fungus called tinea. Tinea lives mainly on the head, which is a capitis species, but also on the body, corporus and unguium, which is a mouthful, isn't it? That's a genital area. So it lives all over us, and it can cause ringworm. The reason ringworm is called ringworm is because fungi often grow in circles. If you go outside and see where mushrooms grow, you'll see they'll grow in circles because they follow the nutrients, and that's how their hyphae grow and spread around. So that's also happening on our skin. So this sort of characteristic sort of ring-shaped rash caused by tinea was named ringworm. But please don't think it's got anything to do with worms, because it hasn't. Tinea needs to go from host to host to survive, so good hygiene and infection control is really important in eliminating this infection. There's your note, nothing to do with worms. So these are some words that you might come across. So it could be zoophilic. So whenever you see the word zoo, that means animal, in whatever word that might be. So it can come from an animal. So you can catch tinea from a pet, a dog, or a wild animal. Or it can be anthrophilic. Anthro means people, so it can come from another person as well, the source. Here are some pictures of tinea infections of different parts of the body. So on the scalp is a kind of classic place to get it. So you can see the round lesions and the hair's not growing. Okay, there we go. Also, these are forearms. So you can see you've got this classic sort of round rash, pink. That's going to feel a bit itchy and uncomfortable for our patient and a bit sore. There we go. There's a really close up, and it's perfectly round. Look how the hyphae just spread in that. It's very efficient. They'll spread all around, and all the hyphae are trying to do is just stretch and branch across the skin to collect as many nutrients as possible. Fungi are really efficient at doing that, and that's why they grow so quickly sometimes, especially in the wild. This is a tinea nail infection, which is a bit trickier to spot. I've given you some reading to look at to try and differentiate these different nail infections. So this one, there's some roundness, and can you see the nails gone all thick and kind of brittle? That's a classic indicator of a fungal nail infection. Something you'll see plenty of in pharmacy is the athlete's foot, which, to give it its appropriate name, is Tinea pedis. So tinea is the fungus that causes athlete's foot on the whole, and pedis means foot. Anything to do with ped means walking or foot. Athlete's foot is super common. You're going to come across it. You may have already had it yourselves. It affects around 15% of the world's population at any time. It's twice as common in men, perhaps because men are more likely to sweat as a result of higher testosterone production. There are lots of things that you can advise your patients to do to try and avoid athlete's foot, because the risk factors are all pretty much preventable. So damp feet obviously can be eliminated. Tight shoes with poor ventilation you want to avoid if you're prone to athlete's foot, and barefoot in communal areas, which none of us have been doing recently anyway, because we can't go anywhere that's communal, can we? So, but on the whole, you want to try and avoid these things. And this is how athlete's foot presents in our patients. You can see classically between the toes, you get this kind of sore, itchy, exposed skin, as the fungus is basically using skin as a nutrient and trying to expand further into the skin. And that fungus will spread away between all these toes, and in a family that will easily transmit to another individual. If you're sharing towels or you're walking barefoot at home, etc., really easy to pick up an athlete's foot infection that way. So good hygiene and infection control at all times is really important. So that was tinea. Now we're going to look at my favourite fungus, Candida. Candida is an amazing organism. It's a yeast. So a yeast is a single-celled fungus. Candida is just the perfect pathogen. If you wanted to design a pathogen, you would design Candida. It's got so many interesting features, and it's proved extremely difficult to manage. It lives happily in yeast form. So yeast here on the left-hand side are kind of like oval buds. They're quite large. They're about 5 microns in size. So an E. coli is about 1 micron. So it's compared to a bacterium, it's about 5 times the size. Yeast are simple eukaryotic organisms. They're single-celled. They bud to reproduce. There's a little bud here just coming off this one. And they split, binary fission. We love yeast because we use them as kind of a model for other eukaryotic cells. They're easy to grow in the lab. They're not very fussy about what they'll eat. You just need to give them some sugar and some warmth and they're happy. Now, Candida is very special because what Candida can do is switch, and this is called dimorphism. So Candida will happily grow as a yeast, but when things get interesting for Candida, and interesting things for Candida include the presence of blood, loves a bit of blood, the presence of a nice body temperature, so when things get around 37 degrees, and there's some serum available, they start to change. Jekyll and Hyde, think of it that way. I never know which one's which. I think Hyde is the nice version and Jekyll's the evil one. So we're moving to the evil version now in the middle. And what happens is when these conditions are available, so warmth, nutrients, etc., Candida starts to make hyphae. Look, can you see? Starting to grow its little germ tubes, these are called, and make hyphae. And all the genes that are responsible for making those proteins are switched on when the higher temperature and the nutrients are detected. So it does what's called the phenotypic switch. All these things turn on, and now it's becoming a pathogen, which is not good news for our patients. And you can see them. Look at this lovely phase contrast image of a fungal hyphae growing the germ tube, and that happens quickly. If you put Candida into a warm environment with some serum available, that will happen in 1 hour. So you can actually watch it happening in the lab down the microscope. They'll grow these tubes, and that makes them invasive. They can branch into tissue, they can attach, they can disseminate throughout the body. So they become pathogenic as a result of those hyphae. So very clever adaptation. And Candida can cause lots and lots of different infections in our body for that reason. It's also really adaptable. So it lives on us. It's what we call commensal. So about 25 to 30% of us carry Candida on our skin, and lots of us in our mouth. I don't. That's one of the advantages of being a microbiologist, is that you get to sample yourself often. You find out what's growing on or in you. I don't have any Candida, but about 30 to 40% will have in their mouth. Some people carry it in their guts, on their skin. So Candida is amazing. It can live anywhere. It doesn't mind having no oxygen. It will happily live in our guts. It doesn't mind competing with bacteria for nutrients. It doesn't mind oxygen. So it's not fussy. So you'll find it all over the body. Candida albicans is the species that causes most trouble in humans. There are some more emerging Candida species, which we'll talk about at the end of the lecture, that are also now starting to become more prevalent. The pathogenicity we talked about in terms of the hyphae, but it can also produce enzymes which help it digest the host tissue and acquire nutrients and compete with bacteria for nutrients. Some Candida can produce toxins as well. If that wasn't enough, it's also, remember, it's a single-celled organism, so it grows and divides quickly, which means it's really, really good at becoming resistant to anything that we try and kill it with. It's got a quick generation time, just like a bacterial cell has. So resistance is a big issue for Candida treatment too. This is a slide to show you how adaptable Candida is and how it can grow on the body. So this is a Candida, an oral thrush, sometimes called Candida infection of the mouth. This is very characteristic. Candida always has these big white plaques. Can you see them on this tongue? And that's the hyphae. You can actually see them macroscopically. Oral thrush needs investigation. If you have a patient who presents with oral thrush, that is somebody who does not have a healthy immune system. There is something else going on there. It may be that they are taking some drugs that suppress their immune system. They might be a HIV positive patient. They might have some underlying issues that are worth exploring. It's easily treated, but it's a sign, it's a red flag for other immune system issues. This is a child who has a Candida infection because they have sunburn. So this child, can you see that they had some sunburn on their lips? And this has allowed the Candida that is carried on the skin of this child normally as a commensal to invade. So can you see that there's some plaques where the Candida have managed to invade the damaged skin. And the mouth is moist, there's nutrients available, Candida is very happy to live there. And it's just, it's become a pathogen, what we call an opportunistic pathogen. So that lesion has allowed the Candida to infiltrate the skin. This is an infection of the hand webs. Can you see between the fingers? It's nice and moist in there. It's often occluded. So it's really important to make sure that fingers are dry between the webs. This may be somebody who works with somehow works where their hands are getting wet. So they might work in the food industry, they might work in a bar, something like that. So their hands are often wet or not fully dry when they're working. This is quite a serious candida nail infection, just to show you that the candida can actually destroy the whole nail, right? And this is not good for this patient, because the nail is protecting the hand and protecting the body from infection. So once the nail becomes destroyed, there's more risk for bacterial infection in here and more serious complications. Right, so this needs to be treated. This horrible red rash here is probably, I think it's a knee. So the knee is a classic place to get a fungal infection, anywhere where the skin is occluded. So the elbow, the knee, the groin area, where there might be occlusion happening, is a risk for candida. So there's more nutrients because the sweat's there, it's occluded. There might be some rubbing together of flesh, which will allow some lesions to occur, which will then allow the candida to grow. And you can see this really characteristic red, and that will spread. So it's got, can you see these little red dots near the rash? They're called satellite lesions, and they're the hyphae that are extending and moving along the skin to get more nutrients, and this rash will continue if it's not treated. Right, so we need to kind of knock these infections on the head early on, because candida can become systemic and invasive if we don't treat it properly early on. Okay, so what I'd like you to do now is do some research on your own. I want you to go and have a look at why systemic fungal infections, so fungal infections that reach our organs, that are invasive, that become quite serious and ultimately can be life-threatening. So have a look and see what you can find about why that is recently. Why is that happening? And if you can, see if you can find out some evidence, some appropriate evidence. So think about what you've learned when you've been doing your coursework, when you've been doing other things that I've set you to do, reading-wise, some appropriate evidence. So evidence that comes from a good source that's been reviewed, and just summarize that in a few sentences for yourself, and just think about how you would, in practice, protect those people who are at risk from systemic fungal infection. All right. Thank you for listening to part 1, and I'll see you for part 2.